Good evening. I think we've heard a lot from both the speakers and Dr. Tender and Rajiv. They are veteran in the field that they, in fact, he has given the insight of the industry, what is happening, what is required, and what efforts are going on. On the other side, we have the requirement, probably what Dr. Tender is saying, this is what we need. I am come from the diagnostic industry where I provide the diagnostic services and, of course, the advanced technology services which are at the user end. I think the first and foremost important probably in the industry today is to, we have, I think, a lot of manufacturing or testing or the processing or whatever we are doing. I think to understand the need. And that's where probably I think industry is slightly now heading for, because currently in the medical devices industry, everybody is heading, looking for an advanced care product. Something which is like, okay, because somebody requires a stent is required, something a knee transplant is required. They probably the various interests because there are margins and probably the high-paying people who can afford this. But I think it's important to change our mindset from the industry point of view and like, can we have the devices which are more focused on the preventive monitoring? And this is where I think the 40% of the healthcare problems are in the non-communicable diseases, which is easily preventable, curable, and monitored if you monitor them well. I think the devices which are now into this area, they can be low cost, and I think you can, by the scale, volumes, we probably can do wonders out there. And that's, I think, the requirement, I think focus should change from the advanced kind of a thing. That can continue fine, but I think advanced is still being served by the 70% needed by international market. But I think more focus should be on the preventive and the curable, anything or technology or instrument which be affordable, accessible, quality driven, and used at a very peripheral level, which is not really happening. I think that is something that now of late, I think we had a couple of presentation previous this thing, and I think that people are coming for youngsters, the innovators coming out. They're coming out with more and more new technologies, which are the handheld devices, point of care devices, the smartphone devices, and this is, I think, probably a solution to one of our major healthcare issues, and that will also drive the market in a different direction. When it comes to the quality, I think. And I will just share one example probably. We are into very high-end technology testing where we get testing at the molecular RNA, DNA testing level. Somebody got a cancer, okay, what is the mutation, all kind of a thing. But then these technologies were very, very expensive. A single test, which probably early detection of a lung cancer costs about 40,000, 50,000, probably I think a normal man cannot afford it. So I think it's important to get these technologies validated, and in-house system which should be developed where, and there are multiple R&D people that are working online on it and off and inside the lab within the closed premises to bring down the pricing. Can we validate it for the Indian population, India's specific population, and we can give the information which is actionable information. This is another, because we have a lot of technology which is giving you okay, 2 parameters are actionable, 9 are not actionable, but we are sending, oh, this is give you this information, but what to do about the other 9, which is probably of no value to us today, maybe future, yes. I think that probably again can help you to bring down the costing also, because you'll focus today, for India specific today's need. Subsequent years, yes, this already we can add on. One costing part, I think India has always been a cost-sensitive market and the price-sensitive because individual pays from the pocket here. Government is doing a lot in various fields and a lot of things which have been shared in the past at multiple forums, and I think we are all approaching and government contribution is appreciated on that part. But I think one important thing is because all the private sector people, they have R&D labs. But there are, I think we can provide probably, can we have a big R&D lab where I can take my product and go start doing testing inside it and use it for 1 month and come out. So I don't have to invest into R&D right there. I think that's probably an area where we can, that'll help me to cut down because investment will go down out there. Simple innovation, what I did in one of my labs, because in centers where a glass slide is there, we just put a cover slip. I'll share with you because the cover slip is about, say, 1 centimeter by 1 centimeter in diameter. And I have to see only 200 cells to identify the, or make a diagnosis. But then, cover slip does not exist, I think probably 1 centimeter by 1 centimeter, that's the minimum size that exists. So, we made a small, get something made locally is about 0.8 millimeter of the cover slip, which is a round, which can easily cover 500, 600 cells. The cost came down by 1/4 because when you use 50 microliters of reagent or you use 20 microliter, the prices come down. I think these are simple methodologies, simple processes, which should be, I think, which is now people are adopting, the youngsters are adopting, and I think which can be used to bring down the costing. That's, I think, everybody is into looking at it. And the last and most important part I like to share is, I think, the perception. Now, this is a challenge because people feel that, oh, this is a foreign product, it's going to be very well. This is an Indian product, it may not be that up to the mark, but which is probably wrong. I think a lot of efforts have gone into it. In this side, we have self-regulations on the quality, and we have to compete against the international people. So the perception has to be changed. I think that's where a lot more government support is required. Robust ecosystem where they can help us by, technologies can be created, but can they be adopted at multiple forums and by the public-private partnership model, or creating a public awareness, our product, or we can be showcased outside. Okay, this is something we take it to our product to South Asian countries, and we are selling, because countries like Costa Rica, Malaysia, Ireland, they have products which they're capturing almost the world market, but they can do it, why can't we do it? That's what it is.
Thank you very much, Dr. Gaur. Just for your information and information of the audience, the R&D lab that you're talking about, Andhra Pradesh MedTech Zone is setting up 12 mega laboratories, one of them being Rapid Prototyping and MedTech Innovation Center, Industrial Research Center, not a theoretical lab-based academic research, but actually when you come up with a prototype, to test it, validate it, produce first set of 100 prototypes for you so that you can scale up a pilot for the clinical part. That is something which is coming up, for which we are hopefully partnering with a firm known as PA Consulting, which is world's largest rapid prototyping center based out of Cambridge. Lot of things that you are mentioning are happening. The takeaway for me from this session would be, as on today in medical devices sector, we have more positives than negatives. We are certainly on a positive note and moving faster and faster. Hoping that what Mr. Nath was saying, the healthcare provider sector, the service sector would tap into the effectiveness of this growing strength of medical devices segment without diluting it by mechanisms that are not completely industrial in nature, but are based out of conflict of interest mechanisms between different stakeholders, whether it is price of stent or price of a lab test, or the incentives given to a doctor to prescribe those lab tests. And a very simple example, there are laboratories that have package, preventive healthcare package, in which it says they will do HbA1c, 3-monthly package. The Cochrane, which is world's largest reviewer of clinical evidence, and the systematic reviews available globally, says HbA1c, which is a golden test for diabetes, doesn't make sense if it is tested below 6 months. The minimum time period you need to have before testing HbA1c twice is 6 months. But there are labs that bring out preventive packages which are non-evidence based. So hoping that the service market won't dilute the product market because of reasons of conflict of interest, but would actually strengthen the healthcare market by balancing correct demand with cost-effective, good quality supply. I extend this humble invitation to all of you to be with us in Visakhapatnam on the 19th of August for the foundation laying ceremony of Andhra Pradesh MedTech Zone, which is said to be the brightest chapter in medical device growth story of this country. We hope that this session was useful for you, and we will conclude it here. Thank you very much.